Hi, I'm Aubrey.
I'm Jimmy.
I'm Amy.
And we are doing the proximal radioulnar joint. All right, so this is the humerus, this is the radius, and this is the ulna. And then this is going to be the joint we're looking at, so the proximal radioulnar joint. So this joint is a diarthrodial synovial, so diarthrodial means it's freely movable, and then synovial means that it is, the radius and ulnar are separated by a joint capsule. And then specifically this is a synovial pivot joint. So this is located in the circumference of the head of the radius, which is going to be here, and a ring that's formed by the radial notch of the ulna and annular ligament. So that's going to be right here. And then specifically the radial head rotates around a proximal ulna. So that is going to be right here, and it's going to rotate around. And it is enclosed by a single fibrous joint capsule.
Okay, so now we're going to talk about the ligaments of the proximal radioulnar joint. The proximal radioulnar joint is a large joint, and it's loose and weak, especially moving in the anterior and posterior direction. It's going to be supported medially and laterally by the collateral ligaments. So the first ligament we're going to look at is the annular ligament. The arm right now is in anatomical position. We're going to kind of pronate it a little bit here, and then this pink ligament will be the annular ligament. It's going to wrap around the radius, attaching to the ulnar knot, the radial notch of the ulna. So it's going to surround the head and neck of radius, which will allow for the rotation of the radius without disruption of the overall joint capsule. So the next ligament we're going to go over is the radial ligament, or the lateral collateral ligament of the elbow. This is going to be the blue right here. It will attach from the lateral epicondyle of the humerus to the annular ligament along the ulna, which is represented by the pink piece of index card there. The radial ligament will resist lateral force originating from the medial side. It's less common to injure this ligament because medial to lateral forces are generally protected by your body. Okay, and the third and final ligament we're going to go over is the ulnar collateral ligament, or the UCL. So this will attach from the medial epicondyle to the coronoid and olecranon processes. So there are three bundles of the UCL: the anterior, posterior, and then the transverse or oblique. And they're going to attach kind of like this. So you can see anterior will run anteriorly from anterior to posterior. The posterior bundle is going to kind of come behind it. It's going to run almost horizontally. And then the last ligament will be, or the last bundle of the ligament will be the transverse, which is also going to run forwards and backwards, but more lower than the anterior bundle. So the UCL, or ulnar collateral ligament, will resist valgus forces, which are a medial force originating from the lateral side. This is common in baseball pitchers and other overhead athletes. Rupture of the UCL will require Tommy John surgery, which is very common in pitchers. It is corrected by surgery, where you take a part of the palmaris longus and then reattach the UCL up here. So to recap, the pink here is the annular ligament. The blue is the radial ligament, or lateral collateral. And then the white represents the three bundles of the UCL, or ulnar collateral ligament.
Motions of the proximal radioulnar joint are limited to rotational movements of the forearm. So those two motions are going to be supination, which I'm demonstrating here, palm up, and then we have pronation, which is palm down. The muscles that aid in these motions are the biceps brachii, which is going to run from here down to here, and then the supinator, which is going to run kind of along this plane. And again, those are here where our palm is up. And also the extensor muscles of the thumb are also going to aid in supination. Then we have pronation, palm down, and those muscles that are going to aid in that is the pronator teres, which is going to be kind of in this area, and then the pronator quadratus, which is going to run over here to allow us to do our palm down and move. In the proximal radial ulnar joint, there are two possible malalignments that we could have. We could have a cubital valgus, which is a lateral deviation, and that would kind of increase your carrying angle. And then we also have a cubital varus, which is going to be a medial deviation of your distal segment, which is mildly hard to show, but we would be moving in this way.
And that concludes our presentation.
Yay!